Hi, my name's Nee. I'm a new graduate nurse. Today I'm going to deliver to our nursing team a presentation on compassion fatigue in our area of specialty, palliative care nursing. Let me start with a story about Nurse A palliative care nurse who went above and beyond for her patients. She was nominated and won the Excellence in Nursing and Midwifery Award. However, over time, people started to see changes in Nurse A. She was no longer the warm-hearted nurse that everyone known. She made multiple medication errors and her need of sick leave increased. Eventually, Nurse A resigned and left the field. So, in this presentation, I'm going to talk about the definitions of compassion and compassion fatigue, as well as explain to you why compassion fatigue is so prevalent in our palliative care nursing population. I'm also going to discuss the significance of compassion fatigue in relation to the safety of our patients and the health of our workplace. Finally, I'll talk about what's being done about the issue of compassion fatigue and how we, as informal or formal leaders, can participate in its prevention and management. As we all know, the nursing profession is closely associated with compassionate care. In fact, compassion is deeply embedded in the nursing code of conduct that guide the professional practice of nurses of all levels in Australia. So, what's compassion? A systematic literature review by Brett and colleagues concludes that compassion is a combination of one's sensitivity expressed in response to another person's suffering and their desire to act in order to change the situation. However, this caring attitude can become a workplace hazard which is known as compassion fatigue. Compassion fatigue results from direct exposure to traumatized individuals rather than the trauma itself. Unlike burnout, which is related to failure to meet workplace expectations and issues such as excessive workload and short staffing, compassion fatigue occurs through the absorption and internalization of others' emotions. The fundamentals of palliative care are holistic care and symptom management of patients with life-limiting illnesses. Palliative care nurses are susceptible to compassion fatigue as they routinely witness and directly manage patients' pain and other physical symptoms associated with these illnesses. Furthermore, the day-to-day palliative nursing care heavily involves the social, mental, emotional, and spiritual needs and distress of patients and their families, which are naturally provoked by death and dying. So, how does compassion fatigue look like? The most pronounced signs of compassion fatigue are declining ability to provide empathetic and holistic care and decreased clinical performance. These are usually attributed to by physical and emotional symptoms. Physical symptoms can be declined general health, fatigue, aches and pain. Emotional or psychological symptoms include indifference to other suffering, intrusive thoughts, hopelessness, frustration, spiritual emptiness, and a sense of disconnectedness. Apart from the impacts on nurses, let's explore how compassion fatigue can take its toll on the quality of patient care and our work environment. Patient safety is defined by the World Health Organization as the total elimination or maximal reduction of potential harm that could occur to a patient who is a recipient of a care service. The link between patient safety and compassionate care is evident. When a nurse's ability to concentrate and make clinical judgment and decision declines because of compassion fatigue, patient safety is compromised due to the occurrence of unintentional errors, miscommunication with colleagues, as well as patients and families, and lack of responsiveness to patient needs. According to the Australian Human Rights Commission, the healthy workplace standards are being supportive of professional development, mental burden being identified and removed, valuing diversity, low staff turnover and sick leave, high staff retention, and workers being active team members. As a nurse's well-being is negatively affected by compassion fatigue, they may start to have relationship issues, refuse to assist others, and abandon collaborative practice. Their workplace suffers from increased absenteeism, reduced staff retention, increased psychological injury claims, and decreased productivity. A workplace affected by compassion fatigue does not meet the healthy workplace standards mentioned in the previous slide and therefore is not deemed to be safe and healthy. A cross-sectional study by Cohen and colleagues also found that positive work environment does enhance patient safety. This essentially suggests that with effective communication and strategies, the impacts of compassion fatigue can be mitigated or reversed to foster a healthy workplace and safe patient care provision. So, what's been done about compassion fatigue? The introduction of Principle 7, Health and Wellbeing, in the current Code of Conduct marks the systemic recognition of the costs of caring in nursing. This principle also aligns with the nursing standards of practice such as Standard 3 and 6. It's a nurse's duty of care to maintain their health and capacity to provide optimal patient care by taking initiatives in exploring compassion literacy to identify, seek professional help and support to reduce fatigue and stress of self and their colleagues. While the exposure to trauma and traumatized individuals is unmodifiable in our practice environment, support services are available. For example, the National Service of Nurse and Midwife Support offers 24/7 counseling over the phone. The Essentials of Care program by the New South Wales Health values and supports the principles of safe, effective, and compassionate workplace cultures. Coffs Harbour Hospital of the Mid-North Coast Local Health District is one of the health facilities that embrace the Essentials of Care framework. One of their initiatives is running a mentorship program that provides oncology nursing staff with awareness of and coping strategies for signs of compassion fatigue. The Australian College of Nursing encourages all nurses, like you and me, to become leaders who can make things happen. There's evidence that strong nursing leadership is one of the many factors that can prevent or reduce the impact of compassion fatigue in clinical settings. Interventions that any nurse leaders can employ to conquer compassion fatigue are acknowledging that compassion fatigue exists, normalizing the phenomenon of compassion fatigue by including it in staff meetings or discussions like this presentation. Nurse manager can then develop plans to approach this issue. Acknowledging colleagues' contribution and efforts, this creates a positive energy among staff as their compassionate work doesn't go unnoticed. Recognizing and educating nurses who are experiencing or at risk of developing compassion fatigue through mentoring and support groups inside and outside of work. Talking or debriefing after any intense, difficult situation. Offering support or promoting the benefits of counseling, and most importantly, attending to own self-care needs such as physical nourishment to replenish self-resources. I'm aware that my lack of experience and high level of empathy make me vulnerable to compassion fatigue. As a new graduate nurse and also a new nursing leader, apart from abiding to the nursing code and standards and the leadership skills mentioned in the previous slide, my responsibilities in maintaining compassionate patient care and preventing compassion fatigue, especially in palliative care nursing, include making time for healthy self-care rituals such as meditation, being assertive in voicing my personal needs and values, utilizing any available resources such as my preceptor, senior nursing staff, or the employee assistance program, and seeking education related to compassion fatigue and resilience building. In summary, compassion fatigue is prevalent in palliative care nursing because of our routine exposure to patients and families suffering. Compassion fatigue needs to be addressed not just because of its significant strain on our well-being, but also because of its negative impacts on patient safety and our workplace environment. When nurses lose the ability to perform and practice safely and adequately, the safety of patients is at risk and our workplace suffers. The current nursing code and standards have suggested that it's our responsibility and duty as leaders and patient advocates to look after our own physical and psychological well-being and address issues that may compromise our safe practice. This can be achieved by seeking and utilizing any support available, prioritizing self-care and looking after one another. Thank you so much for listening to this presentation and take care.